Okay, hi everybody. My name is Kristen Zontek, and I am presenting on public health and the role of the government. So in this presentation, I'm going to go over the overview of the definition of what public health is, discuss the role of the government in public health, and talk about the New York Times article in relation to this topic. The New York Times article I found is titled, "They're All Bad for You, but Should They Be Illegal?" by Fran Silverman. What exactly is public health care, or public health? As the book defines it, public health is usually defined broadly as the efforts made by communities to cope with the health problems that arise when people live in groups. The community sees the spread of certain communicable diseases and have the desire to maintain the cleanliness and safety of the environment, provide safe water and food, as well as sustain disabled and low-income populations. Public health is what affects the status for large groups of people, and therefore it causes common concerns among all. There are different ecological models that public health has adapted to and has applied to its pursuits. The models involve the many factors and determinants that impact the health status of groups. According to the textbook, these factors include physical environments in which people live and work, political conditions under which people live, human biology and genetics, social factors such as economic circumstances, discrimination by race, ethnicity, gender, or sexual orientation, and the availability of familial or other social supports, behavior choices, and cultural norms. A brief history of public health issues includes that certain religions promote public health in their beliefs, such as Hebrews practice based off what the Greeks believed, which is personal hygiene, and ancient civilizations promoted health and disease prevention by learning patterns of individual behavior. Then there was the Romans, who thought that public health should be controlled and managed by the government. I think it's interesting to see how public health is seen differently among different groups of people, and how public health concerns became important for laborers and soldiers in Europe in the 16th and 17th centuries. So now that we know what public health is about, I'm going to talk about the role of the government in this topic. I actually wrote a paper on the high mortality of infants in the 19th century due to the spread of diseases and poor public health awareness. People who were sick exposed diseases to their families, and when the families were to go out and about, they exposed it to whoever they came in contact with, and that is why diseases were spread so easily and so much. There were not many reforms or governmental recognition until the end of the era, when they finally started recognizing the filth on the streets of the cities and the poor health among all the residents, or most of the residents. There are also some laws that are passed for certain causes. The government may recognize specific groups of people who go through specific troubles. For example, in 1798, President John Adams established a public health service, the Marine Hospital Service, for the people who were at sea and were sick or disabled. The Department of Education and Health, Education, and Welfare combined together and created an organization called DHHS. And they carry out public health activities through groups such as the Food and Drug Administration, the FDA, Centers for Disease Control, CDC, and Health Resources and Service Administration, and many more. There are actually over 300 of these public health groups through DHHS. And they all target specific public health issues. The New York Times article I found discusses which public health laws are invading the public's privacy and what exactly should just be left up to the individuals to decide for themselves. Some examples are smoking in the car with children, and also serving partially hydrogenated foods in public areas and in restaurants. According to the article, if all laws were passed towards public health by the state legislature, it would ban restaurants from serving food that contains trans fat and require calorie and nutrition information on menus. It also bar adults from smoking in cars in which young children are passengers of, and would also require insurers to offer discounts to policyholders who lose weight. Political legislators express concern on how it is hard to draw the line between what is too intrusive and if the government would be nannying people into making these healthy decisions instead of just making them for themselves. The article states that people think that bills to stop smoking around young children to prevent asthma and other secondhand smoke problems is restricting people's rights to privacy, and that the government might as well just have the key to their home and fine them for everything wrong that they do. As for the restaurants, if serving unhealthy, fattening foods with lots of calories is so unhealthy, should it be banned by the government for restaurants to do so? People explain that they know what they're getting into when they come to these restaurants and that they cannot blame the restaurants for serving food or such foods. I found that this article is really interesting to read about on what goes on behind the thinking for when it comes to passing laws to promote public health or not to pass them. And this also helped describe how the government is involved in public health. And these are my sources. The end.